Hello, this is Dr. Dheeraj Masapu. I'm a senior consultant in the field of neuroanesthesiology, and today I would like to discuss the problem of quackery in India and which specialties they have infiltrated and what are the safe specialties if you want to avoid this problem. So, before going into the specialties, I would like to tell you what is the impact of this problem. So, the problem is not a simple thing, it's not a very superficial thing, it's a very deep rooted problem. That is, why I'm doing this particular video. And according to IMA website, official information is that there are around 10 lakh, okay, 1 million quacks in India, okay, who are practicing modern medicine, that is allopathy, without a qualified degree. So, qualified degree is what a person who is registered in the state medical council. So, they wouldn't have anything like that, but still they would be practicing modern medicine. Okay, 10 lakh people are there, guys. We are only some 15 lakh doctors in India. In the 10 lakh quacks are there. So the why I call it a significant problem and it's not a superficial problem is that, see, the quacks are located in rural places, and actually they are the ones who drive the patients to towns and cities. So whom do they drive the patients? They drive to people who are giving them cuts or referral fees. So here a bias is being introduced. A very qualified doctor who is very skilled wouldn't get the patient, and a person who is actually giving cuts to them would get the patient. So this actually creates a bias in the whole Indian healthcare system. So this is being done by quacks at different levels. Okay, this is a very very serious problem and a deep rooted problem. If we don't deal this, even IMA has made an anti-quackery wing, and they have proposed to the government to deal this as an urgent problem. I think we will get support from the government also in future. Okay, so coming to the science behind the quackery. So how actually quack is formed is, the quack is a very common person who without a qualified degree who will join as a compounder or a physician assistant, or he would actually have some kind of other degrees, not an allopathic degree, near a qualified doctor like an orthopedician or an anesthetist. They will actually work with these guys for some significant time, like 5 to 7 years or 10 years sometimes, and they acquire all the skills from these guys, and then they will start practicing. They will go to rural place and they will find locations where no allopathic doctors are there, and then they will start practicing there. That is how they work. But the problem here is their knowledge is only the tip of the iceberg. They don't have the actual mountain of knowledge below. For example, there are some quacks who are actually doing anesthesia. They give spinal anesthesia for cases. So they will only know that you have to do LP and give 2.5 or 3 ml of bupivacaine and heavy. That is all they know. And if hypertension comes, how to deal, or if some patient is having a cardiac disease, how to deal, all these finer details they wouldn't know. So 60 to 70% of the times they would get away. But what about the 20 to 30% of the patients? So that is in every specialty. What happens is they will give bad results to the people, how much ever skilled they are. Since they don't have a physiology background, since they don't have a subject background, they would give a very bad result to the people. Okay, let me show you a struggle of Dr. Anil, who started his practice as a general physician, who started his practice in a town, and he clicked in a very short time. But what happened is 3 4 quacks came to that area and they actually dominated him. The reason being, see, the quacks have certain advantages. They charge less fees, they are more empathetic, and they actually even go to patients' home also if required. So from patient's perspective, that is what they want. If they want somebody who's coming to their home, they want somebody who charges less, who gives them a quick relief. Because most of the times quacks give medicines which actually don't treat the disease, they give a symptomatic relief. So then from patient's perspective, they feel that quacks are actually superior to Dr. Anil, and then Anil's practice was fallen down, and Anil had to succumb to the quacks. And then what happened is, so Anil's practice later on clicked after he adopted such. So then what Dr. Anil did is he had to ensure that he also competes with them by doing certain things. Like he also started going for the home visits, even though he didn't like it, and then he started more engagement with the people who are coming to his care, by phone calls and giving his number and all that. And then he started by educating the patients through social media and also conducting local free checkups, camps and everything. And also he made the care affordable, because the main important factor that quacks have is the low OPD pricing or low procedure costs that they charge. So that is what he took care, and then his practice clicked after that. So then what happened is, what are the medical specialties which are most affected by quackery? You need to know. So general medicine is the number one specialty which will be affected by quackery, and because fevers, infection, colds, and all these things would be treated by them, even though they don't have much knowledge, they would compete with them. And then family medicine and pediatrics also, there is a lot of vaccinations that they would do, and also they will treat children who are sick and have respiratory tract infections and all that they would be treating. Even in OBG, there is a lot of infiltration. They would do prenatal checkups, and then they would actually conduct deliveries and all that. And if the situation is out of control, then they would refer them to some kind of a center, and by the time they reach, it's like out of control situation. And then even in emergency medicine, there are a lot of ICUs in towns are manned by all these quacks. And then in critical care also, there are a lot of people are there. I know personally so many people are working in intensive cares. They just know that we have to take lines and manage the patient. So that's about in critical care. Even in anesthesiology, a lot of people are there. They use spinal anesthesia predominantly. They don't opt for general anesthesia, and some people actually they give anesthesia and they operate also. That is a beauty. And then even in surgery, many people are there. They do piles and hemorrhoid surgeries, hernia, hydrocele, and all those surgeries they do. And then there are some guys who are entering into cosmetic dermatology. They even do fillers, hair transplants, and all that. So in orthopedic, many people are there who work with orthopedicians. They do close reductions, even small surgeries also they would be performing. So these are the different specialties which are being affected by quacks in India. And the quack resistant specialty, which is the topic of today, is the areas where quacks could not enter in future, and that would be more safer for you. Okay, surgical specialties will come in this genre. That is super specialty segment like neurosurgery, complex surgery. Basically, it should be complex like pediatric surgery, where a lot of skill and technology is involved, and bigger centers are needed where quacks cannot enter. So that is the super specialty surgical area is what you have to target. And then radiology is where quacks wouldn't enter. Intervention radiology also is a very good area, and radiation oncology and nuclear medicine, quacks cannot enter. Transfusion medicine and blood banking also, a lot of rules and regulations are there, so quacks cannot enter there. And then ophthalmology, very fine works. Even in ENT, actually, lot of quacks are there who will remove the wax, who will do endoscopy and all that. So even their infiltration is there. But ophthalmology, I don't think they will take the risk because it is a very fine work. And cardiology, a lot of cardiology OPDs also they would see, but intervention cardiology they cannot enter. And neonatal ICU and PICU, so they can't enter. And pulmonology, quacks enter, but intervention pulmonology is area where they cannot. They don't understand this level of complexity. So these are different specialties where quacks, these are quack resistant. Okay, so if you go into these areas, you are safe from the quackery. And there is a lot of legal framework coming. Indian Medical Council Act 1956 and Central Council of Indian Medicine Act 1970. They clearly define who should practice in the state, and the IMA anti-quackery wing is actively working on this anti-quackery bill. And surely in future what happens is the government will come forward, and then they will actually deal this issue in future. So that's the video, guys. And coming to the conclusion, quackery remains a very pressing issue in India, and then it will affect not only the present generation of doctors, the future generation also would be affected. And not only Dr. Anil's story, like that many stories are there in India are getting affected. And the more deeper problem is that the whole healthcare referral system is being controlled by them, and that we need to understand. And we should make more stringent rules and eliminate quacks from the healthcare system. So thank you, guys. Thank you for watching the video. And if you want to join my channel and if you want to watch the videos before anyone, please join the channel. Okay, there is a button down. And see you guys in the next videos. Bye.